the idealized concept of size of penis, the idealized imaginary concept of sexual pleasure, that develops after seeing how you are brought up and what social media, what things you have seen. Suppose somebody grows up seeing porns, or what in simple words, XX, XXX, blue films. You take it from me, if a woman sees those orgies and that real blue films, and if she takes those seriously, like doctor said that why can't she dream of those bigger size, she will never be satisfied if she believes that. And if you have really watched those videos, they go on for hours, 30 minutes. Now if you have any common sense, it is an edited video. And I have seen those models of penises which they wear by doing these shootings, that you cannot differentiate. It is a model exactly looking like organ. They wear on that and then they shoot those things. So that why can't women think is again a very, very, very tricky question, and it is going to doom that girl from Dubai. She was of that type of mindset. Say in that case, then the idea of getting married before ये जन्मपत्री और education and family देखने के बजाय size देख के शादी करना पड़ता. It is very tricky, and the physiology and anatomy of vagina, if all will agree, the initial 1.2 or 1.7 inches is only sensitive. So it is all the mutual pleasure, the touch, the TOUCH is in capital letters. That gives you pleasure, and the intimacy, the emotions. Otherwise, if you go after size and if you go after timing, that is a real doom in any sexual relationship. If you go reading some real literature, yesterday Dr. T.S. Rao showed a concept of female sexual disorder. The female sexual disorder is a very tricky area. Lot of research has been done. Lot of research means so many papers are there. But the bottom line, the scientifically proven concept, I showed that in slide, is directed masturbation. Will you write in your clinic that you teach masturbation? So again the question of rationality, will you give in Indian lady who wants you say you take sex toy, you do this masturbation for a certificate. The mind they don't accept. So again, as Dr. Gavle said, the idea is we need to give them right information, get them rid of misinformation, tell them scientific facts. Otherwise, so all will go after the Africans. You can't match their size. European, you can't match their size. So, it is a big myth. The women should not go after that fantasy. I would try to summarize by giving cases to real life cases so that you know how the conflict works. So this is the commonest case. Case 1 is commonest complaint those who are practicing sexual medicine कि डॉक्टर साइज बहुत छोटा है. Then few will say कि साइज अभी छोटा हो गया, and they are adamant. They will not listen or to any explanation, any argument. Suppose patient comes, he will say, डॉक्टर मेरे को साइज बड़ा करना है, होएगा क्या? Now patient has come, दिन में ओपीडी 5 दिन का ही है, उसमें से फर्स्ट पेशेंट has come and says होएगा क्या? मतलब आप नहीं बोला तो भाग जाएगा, पैसा भी नहीं देगा. So there comes the conflict starts. You have to, I want to tell him that कि भाई तेरा साइज तो कुछ होने वाला नहीं है. But then how to go about it? How long will you be able to hold that patient by misguiding him? So that is the conflict. Now, since time is less, I'll leave that to thinking of other our delegates. Second case, this was a very eye-opening case for me. Patient called on mobile, कि doctor appointment चाहिए. You are a sexologist, no? I said yes. But I want only one treatment. I want P-shot. That was a learning for me because before that I had never heard the word P-shot. So I said, he said, क्या करने का? उसने बोला एक इंजेक्शन लगाना है, PRP बोलते हैं. So that immediately clicked, because being a dermatologist, our field is like filled with everywhere you inject PRP. Trichology, skin ulcer, acne scar, rejuvenation. Wherever you want to treat patient, it is a good like add-on. So that it struck my mind. I said, you come to show me, and what I give to patient is I decide. You cannot decide. He never came to me then. Now this PRP therapy, P-shot, is very popular. I tried to Google on YouTube, and I was surprised to see plenty of videos, plenty of doctors, quacks, non-doctors in this field, and they are posting their videos. So I just had some dabbling in the literature. The medical community never misses a chance. So this is called regenerative therapy for erectile dysfunction. Wherever there is will, they try to find out the solutions. Industry is always there in back of the medical community. So this has been named as regenerative therapy, and in that comes PRP, stem cell therapy, low intensity shock wave therapy. There are plenty of papers. They give ambiguous returns, and in the end they mention one line: more research need to be done. That's it. For me, it is all useless. This is a typical case, means as a prototype, where a 24-year-old call center working promiscuous male with habits of 1/4 of alcohol, say daily or off and on. He had taken so many, say 20 injection testosterone, few decapurable, and this added tetraxport, himcolin, the common cocktail. Nowadays the trend is that doctors give so many food supplements. They are sold in the form of tablets and capsules, and they are very highly priced, and they are very fancy names. Sometimes you are wondering what this patient has brought. So I have decided to devise a method in very shortcut. I look at the food mark. If it has brown or blue or green mark, I immediately know that it is a bogus. But now pharma industry has even deviated from that, and they omit that food supplement part. E52. 24-year-old or younger patient being given testosterone is the worst kind of malpractice in our medical practice. And unfortunate is many qualified doctors are doing that. I don't want to blame or point fingers to our community or colleagues, but many urologists, many psychiatrists, many and general practitioners को माफ कर सकते हैं, but then even the top consultants, they use indiscriminate testosterone. So that is why I wanted to highlight the issues and over-prescription of testosterone. This is just to, in 1996, I used to publish a registered newspaper, Wake Up Doctor, and I had a lead article on liver tonics. Is it a medical fraud? This article gave me so much bad name in our Kalyan Dumbli that many of our colleagues became enemy to me. I received notice from Dabur League company, but I was so pleased that Dr. Siriat Philip is a very famous hepatologist in South, and after 30 years he has published in Frontiers a news article where he not even useless, he has given ample evidence that it is toxic and it is harmful. This much is the idea to highlight is this much is the level of ignorance, and we take so much things at surface level, and anybody telling me just believe. This is just this is the commonest dilemma. Wherever you get a patient with irrational prescription or something funny being done, I really wonder that who actually should treat the sexual dysfunction patients. Forget the simple ones. I'll give an example. Fortunately, I have a very small practice, but I get patients from qualified doctors. One example: suppose patient has stroke in past, patient who had done CABG in past, patient who has done multiple stents in past, patient with renal transplant. So this sort of patient when you get, with so much of drugs list in that, you means I have to be on my toes. Sometimes I really take time. I say you come after 2 days. I have to go through all drug interaction list, and then decide. And this is the main reason where I think here who should treat. Everybody is writing sexologist. Prescribing sildenafil is equivalent to becoming a sexologist. And then some baba ka tel oil, then you dispense from your, that earning part is different, but then it is a very serious issue to tackle such patients. How you go about this? Or this is a common, you go to MP, this I click from a train, these are the boards, Dr. Malik. This is another, they are the old age, this is our Nobili, the on vans they are there. But then look at this, the government of India, FDA, they have officially allowed only these specialists, legally to prescribe sildenafil. That much is the law. Just these are who can prescribe. No, nobody is left. Everybody can become sexologist. Dentist also. I forgot to mention dentist. It is like everybody is trying to reclaim their territory or out of competition. Like POK or Akshay Chin. ये हमारा area, ये हमारा area. This is a very common scenario in medical practice. This is also very interesting. Father came asking for potency certificate, and daughter-in-law allegedly was calling his son impotent. The girl, both were very high-profile employees in Dubai, and the girl was so dynamic. She was overpowering the boy. They had a 6 years of love marriage after the courtship. And she said कि कुछ काम का नहीं बोला मैं मेरा लाइफ वेस्ट नहीं कर सकती. This was her words. So आपसे कुछ होता है तो बताओ नहीं तो फिर छोड़ दे बोला. So after long interview, it was very funny that the boy was normal. They were having normal sexual relationship, but she had those fancy concepts from media and reels. Now that she is not getting enough. And that catch, you may label it as female orgasm disorder. But then, can you promise by treatment कि भाई मैं तुमको ठीक करके दूँगा? I'll make him sufficiently strong that you will be satisfied. So this is a dilemma. I am an HIV practitioner, so HIV patients often demand, but then I am always in conflict whether to give him potency drugs, where he'll behave. They are not reliable. But this is I am sharing this because this one lady, she pleaded me कि डॉक्टर इसको दवाई मत दो. ये फिर बिल्कुल I asked them to use protection while intercourse with wife even if they are positive both because that cross reaction of AIT happens. So she pleaded. Fortunately, I had not given any sildenafil to that boy. I had given only placebo, but he responded. This is another that after reading in newspaper, अभी new drug has come for women sexuality. दे के डॉक्टर मेरा बीवी बहुत ठंडी है, इसको कुछ दे दो. Your mind, your morality, your concept, that ethics part, you have to keep aside. So that they come and then I appreciate this lady for only one reason, that she is so bold. She wants prostitution to be legalized. Saying is very easy, but is it? Would I like my daughter to become prostitute? Would I like my wife or mother to become prostitute? So these politicians, there are debates and discussions, but the issue is so tricky. Now the concept is, this is the biggest concept. Can we write, this is a scientifically proven directed masturbation. This is, we have to treat, we have to make them learn. This is for women. This is the only treatment we can give them. The drugs which are there for women, filbacillin, PD, testosterone, bupropion, all are practically useless. They have a very small window of use where these drugs can be used. For me, I am opening a can of worms. For me, male andropause as a national fighter, therapy fighter, male andropause is an industry invented disease. Give a thought to it. I mean, see, this is a homosexuality is normal. Why we call normal? Because they say many people are like that. It is there genetically like that. So you accept. So declining sexual performance with aging. Why can't we accept that gracefully? Can a 70-year-old male run 100-meter speed, run with the same speed as 18-year-old? Can every student crack IIT JEE? So how? Why we want to target that performance to elderly person? Thank you.